solutions?
That's actually a great question, because in the context of this bill, we're talking about rising federal spending for Medicaid. But there's also rising spending for Medicare. There's also rising spending for commercial insurance because health care costs are increasing at too high of a rate. Does this bill address the actual reason health care costs are rising? No, it doesn't. So why are we focusing on potential lazy young people who need to get to work and not on, let's say, the big time hospitals, which price for the same goods and services as other countries multiple times higher than other countries? Why don't we focus on the Medicare Advantage companies, the insurers, who will make an estimated $1.2 trillion in overpayments, so it's stealing taxpayer money over 10 years. That's more than the entirety of the Medicaid cuts. They could have literally cut exploitation by big insurance companies and not touched Medicaid. Why aren't we talking about Big Pharma and how they exploit their patent monopolies and charge prices incredibly high for drugs that often aren't even novel? To tackle the real reasons why healthcare costs are high, you need to address corporate power. You need to address the interest that if Armada's a lobbyist and campaign contributions and they buy Congress. People on Medicaid, they can't afford to see the doctor. Do you think they have money to buy a voice in Congress? They don't. So when we talk about solutions to lower end Medicaid costs, we should be really talking about solutions to rein in health care costs. Because theoretically, if everyone, like if we had what I want, which is a universal single-payer system, the government would be paying more. But what really matters is the country paying less? And to do that, we need to tackle the big money interest.